the general operational concept for ECQ transition. In the absence of a vaccine, all what we can do is prevent and contain it and mitigate its impact. The government, however, cannot endure the ECQ for an extended period of time as its resources are very limited. Hence, it has to balance between health and economy. As a backgrounder, some precautionary measures have been given by the World Health Organization with the recommendation on easing of quarantine restriction. According to WHO, any plans to ease quarantine restriction should be carried out gradually and in a paced manner, parang yung Mr. President na hinay-hinay lang po, to prevent resurgence of infection, and that a strong and resilient health system should be in place, like testing and tracing. Otherwise, this will likely prelude to resurgence of the disease. Also considered in the proposal is the World Health Organization interim protocol on rapid operations to contain the initial emergence of pandemic influenza, specifically the zoning concept that can be effectively applied at the LGU barangay level. As shown also is our updated National Action Plan operational framework to prevent and contain the COVID-19 virus. Our plan is COVID carrier-centric, meaning to contain the virus, we have to focus our intervention on the carriers. Our revised operational framework added the prevention prior to the detection phase and the adoption of the end-to-end T3 management system for COVID-19 carriers, which mean test, trace, and treat. With the prevailing situation, the following were the key consideration. Next slide, please. In coming up with the general operational concept for ECQ transition. Number one, how the concept can work within the bounds of the current IITF guidelines. Number two, how can we implement the DOH strategy that is national government enabled, local government led, and people-centered COVID-19 response. Number three, how can we protect the economic corridors and zones? Number four, how can we protect and sustain the gains of the current ECQ that we imposed since March 16? Also, aside from the doubling time as consideration in determining what areas to be placed on ECQ, we also include the granular data of incidence rate and attack rate by barangay, municipality, and city. We have also considered how can the government better address the influx of the returning overseas Filipinos and the transport of locally stranded individuals. For the information of the President, sir, we have more or less more than 20,000 OFWs stranded in Metro Manila. And they are also continuously coming for this month, more or less 42,000. And lastly, how can the government apply the economy of force on areas that have no record of COVID cases and relocate forces and resources with mass and concentration on the critical areas that direly needs government action?
Sir, one question.